Hello everyone, I'm Dr. Bhavna Joshi and I will be taking the subject creating an inclusive school. So in this subject today we will be discussing about the provisions for appearing in examination for children with special needs, basically with respect to CBSE and ICSE and CCE and in its implication to facilitate inclusion. So let's start with the CBSE provision for 10th and 12th class. A medical certificate is required to be shown for getting concession to differently abled candidates, and this medical certificate should be made from following one of the agency. It could be a government hospital or recognized institute of national level or a non-governmental organizational or practitioner registered with Rehabilitation Council of India, central government, state government. So either of one can give the medical certificate, and that certificate will show that the child is differently abled in the specific area, and the candidate needs concession with regard to examination. Then the next facility is of Scribe. The all the categories of differently abled, which are in the Persons with Disability Act 1995, all those are permitted to use a scribe for the examination, and is allowed a compensatory time also. So for a 3 hour paper, 60 minutes is given, extra 60 minutes is given. For a 2.5 hour paper, 50 minutes extra is given. 2 hour paper, 40 minutes extra is given. And for 1.5 hour, 30 minutes extra is given. With regard to scribe, for the appointment of scribe, some instructions are there that any person can be scribe, but he or she should not be, he or she should not have qualified same subject degree, and candidate shall have the discretion of opting for his own scribe, and will also have flexibility in accommodating changes in scribe in case of any emergency. Candidate shall also have the option of meeting the scribe a day before the examination, and a suitable room will be arranged for the candidate. Services of scribe shall be provided free of cost, although the scribe is paid a specific amount by the board. Then there is relaxation during the examination also, like the students who have the problem of dyscalculia are exempted from studying mathematics, whereas children with dyslexia, spastic physical handicapped students have the option of studying one compulsory language as against two, and any four subjects from the following which are given below. So teachers are also given special training by CBSE for marking category of such candidates. Then alternate or separate question paper is also there for visually impaired children in case of English language and social science. Separate questions in enlarged prints are also provided in the subject of mathematics and science. Then separate question paper and for practical component, visually impaired candidates are given separate question paper containing multiple choice questions based on practical component against the practical aspect of physics, chemistry, and biology. Question paper administered in the subject of physics, chemistry, biology, mathematics are without any visual inputs, and alternate question papers are also provided for any kind of visual input in the subject of history, geography, and economics, like in the case of maps and all. Then, in the case of ICSE board, for practical examination on request, the council will permit the omission of any kind of map work or diagram or practicals by colorblind students also, and the marks will be given adjusted accordingly. Then compensatory time is given. The regular allowance time in case of disabilities 15 minutes for 1 hour paper, 30 minutes for 2 hour paper, 45 minutes for 3 hour paper. Then scribe, again, the scribe will usually be a student who has not reached the same academic level. If it is for 10th, then the student appointed as scribe will not have attained, will not be have attained their degree for 10th class. Then use of typing of answers is permitted for the students in ICSE board. Reading out of question paper can be done, but the question paper is not explained, and this also is also given. This facility is given to the candidates who have eyesight problem. Then special provision for visually impaired children is they are permitted to sit for the examination in all the subjects except those that are essentially visual in aspect, or they that have practical element in them. Then candidates may be allowed to use computer also with council's provision. In the case of candidates with cerebral palsy, students may be allowed the maximum of double the time allotted to the for the examination, and computer is also allowed to them. In the case of deaf or anyone having speech defect, all the cases are addressed individually. It depends on the degree of impairment which the child is suffering from. The those who cannot who those who are deaf and have speech problem may be excused from any kind of oral examination. And second language requirement is also exempted. Their second language is also exempted in case of 60% of hearing problem is there. Then the CCE, the Continuous Comprehensive Evaluation. This evaluation assessment system has there are many, for using this method of assessment in the inclusion or inclusive system, there are a few things which has to be kept in mind. There are 9 areas which need modification in CCE. Basically, the first one is related to quantity. That means the number of items to learn or number of activities to be completed should be adjusted likewise. Like there should be, the number of questions should be reduced, the length of the assignment should be reduced, number of concepts that are to be introduced should be reduced, and with related to time, adapt the time allotted and allowed for learning, task completion or testing should be adjusted. Like create a timeline for completing a task. It should vary from the other children. Extra time should be given for assessment, assignment completion. Additional time should be given to complete the test. With regard to level of support, increase the amount of personal assistant to keep the child on task or to reinforce or prompt use of specific skills. Like the teacher can read the test questions, they can allow peer tutor and buddy system in the assessment process. The buddy and the peer tutor can help the children with special need. Then setting up the activity beforehand for the students, giving them extra time, check for comprehension of questions and etc. Then next is with regard to input, adapt the way instruction is delivered to the learner. Like visual aid should be permitted, concrete objects should be used, hand-on activities, cooperative group activities, team teaching should be introduced, should be used by the teacher to explain the concept. Then with regard to difficulty, adapt the skill level, problem type, or the rules on how student may approach the work. like students having problem with dyscalculia should be given calculators, simplify task direction instructions, give alternate test, or permit open book test depending on the disability the child is having, focus on the mastery of more functional math problems, grade the spelling separately for the content of the answer. This is very important. With regard to output, allow the variety on how the student can respond to instructions. Like the test can be taken, it depends on, the test may be verbal or written depending again on the special need of the child. Then as a teacher, you can allow the students to show their knowledge with hand-on material. You can ask the student to use a computer for typing instead of writing if they are suffering from dysgraphia. So depending on their need, this can be done. Next is with regard to participation level. A teacher may adapt the extent to which a learner is actively involved in the task, like listen to a taped story while the others are engaged in reading aloud, permit use of colored map uh, instead of labeling, like whole class is labeling, but the child with special need can be asked to just color the map. Then tasked to cut and paste pictures of concept presented, permit use of computer based presentation. This will help them. Then there could be alternate goals for different children, like adapt the goal or outcome while using the same material. Like, for example, in the social science lesson, while others children learn to locate each state and name the capital, you may adapt the goal of a student to be able to match and identify the map and the flag of the country. So the goal of learning can differ from person to person's need. The student with special need, if the whole class is locating state, they are naming the capital. So the child with special need may be given a different goal. They may be given to match or identify the map or flag of the country. So the goal of teaching could be different for depending on the disability of the child. Then there could be substitute curriculum, depending on the need of the child, special need of the child. So as per the need, the curriculum should be flexible as per the need of the child. Then accommodation in presentation, they may be considered for students for hearing, visual or learning disabilities. They change how students receive information, like oral reading, they have audio tapes, then large prints, magnification devices, sign language, braille, tactical graphics. All these things can be used as per the child's need and disability. So these are the few areas, few parameters which need to be taken care for implementing CCE in inclusive schools. So I hope you understood. I hope you all understood the topic. Thank you very much.